I'm Sally O'Meara. I'm going to try and find my perfect spot here so we don't get any feedback. Like Sarah, I have gained and lost things through MG, and one thing I noticed when I got dressed this morning is there's definitely more of me to love, thanks to limitations and activity and medications and things like that. So I had a picture of Sally and the Great Pumpkin as my Facebook picture, and so once Halloween was over, I'm like, okay, I need to do something else. I chose the Pillsbury Doughboy because that's kind of how I feel. It's like, woo, there's more of me to love. So that's a feeling that's very common among many, many of us. But I'm here to talk about better breathing through technology, okay, and respiratory support for patients with MG like me. Yeah, just a little bit. Okay. Thanks very much to Conquer MG for the invitation to come out, and thanks very much to my husband who gave me the ride. Okay. This is me. I thought the little picture was just perfect. I did want to be a nurse when I grew up. I've been a nurse for 27 years now. I've worked primarily medical surgical nursing and rehab, and now I feel like I've come full circle, and now rather than being the rehab nurse, I'm the rehab patient more often than not. But it's okay. I graduated with a master's degree in nursing education in 2006, and I'm very fortunate to have that because I'm a strong believer that the nurse should walk better than the patient. And so now I'm educating for future nurses, and my students don't mind if I walk around the classroom with a cane. So my patients might not be so okay with that. And I do teach at Oakland University School of Nursing. I teach medical surgical nursing. I teach research, pharmacology. I teach all sorts of things there. Okay? My symptoms started in 2010. It took me 4 years and 10 neurologists to get my diagnosis. Very, very frustrating time. During that time, I did a lot of research into MG, and I was very fortunate to have access to the university library database to really help with that. So when I finally did get my diagnosis, I was extremely knowledgeable about my disease. Okay. The doctors at U of M, where I see my pulmonologist, my neurologist, they said, yes, chronic neuromuscular respiratory failure, I can add that to my nursing diagnosis. They made that official last year. And as Sarah mentioned, there's a fair amount of grief. I was like, oh my gosh, that was a grieving process. Worked through it. I'm like, okay, that's what I have. I've got the tools to make it easier, so be it. I have a Trilogy home ventilator. I use it at night, and I use it during the day as needed. So if I feel short of breath, I feel like my breathing's not doing so great, I'll go hide out in my bedroom, put on Netflix, put on my vent, and just relax and let it do the work for me. Really very, very helpful. And so what I'm here to do is help explain to others with MG that these machines are out here to help your breathing get better and help you feel better in the process. My goal is to share my research with others. I went through a huge struggle to get diagnosed and get these machines, and now my goal is to make things just a little bit easier for others with MG, so they don't have to go through all the struggles that I did. Okay. There's no professional disclosures, no conflicts of interest. I'm here because I want to be. Nobody's supporting me, no Alexia, no drug company, no big pharma. It's just me. Okay? It's just because I have a desire to help others benefit from what I learned along the way. Okay? Now down to business. Breathing with MG. When the MG affects the respiratory muscles, it can cause acute respiratory failure. We call that a crisis. It can cause chronic respiratory failure, so this isn't as bad, but it's all the time. It can cause collapse of air sacs within the lungs, and that's called atelectasis. Okay? So if somebody listens to a lungs with a patient with MG and atelectasis, they're not going to hear a whole lot of air moving in and out of those airways. The lungs are going to be very, very quiet, okay? And it makes it much harder for that person to breathe. Aspiration pneumonia is very common with patients with MG. Because it's so difficult for people to swallow, it's very easy for food and fluids to go down the airway rather than the esophagus, winds up in the lungs, and it causes pneumonia. That's very, very common with MG. And it can also cause a lot of sleep disorders. A lot of people without MG have sleep apnea. Well, that can happen to people with MG, but it tends to be worse. Also, when we're breathing very poorly during the night, we tend to retain a lot of carbon dioxide, and so that causes problems with sleepiness and hangovers and headaches during the day. So some symptoms that you want to watch out for. Okay, shortness of breath with activity or at rest. Okay, people who become short of breath with activity, we call that dyspnea on exertion. That's the official term for it. You might see the abbreviation DOE. Okay, and that's bad, but worse is shortness of breath at rest. Okay. So if you are feeling short of breath and you're not doing anything, that's a very, very concerning sign. The inability to breathe when laying flat. I was working with my students in the lab the other day, and the mannequins were laying flat as we were doing procedures with them, and I'm looking at them with some jealousy, like, this mannequin has a skill that I don't have. That mannequin can breathe laying flat. And I was quite jealous. Like, oh, okay. We call that orthopnea. So that's the official term for it. And that's a sign that the respiratory muscles are becoming weak from MG. Okay. A single breath count, less than 25. A single breath count is a great assessment tool because anybody can do it anywhere, no tools needed. Take a big deep breath in and count out loud regularly as quickly as you can while saying each syllable. Normal, healthy people can get up to 50. Okay? If you take a big deep breath in and you're counting out rapidly, saying each syllable of each number, and you can't get past 25, that's a very distressing sign. That says something is seriously wrong with your breathing. It's time to see the emergency room or the neurology doctors. Okay? Slurred speech with a wet nasal voice that tells you that the muscles in here are becoming weak, puts the person at risk for aspiration pneumonia, inhaling that food and fluids. And that's a great way to bring on a myasthenic crisis. This was me for a while, waking during the night feeling short of breath. Okay? When even if you have a nightmare, generally you're not going to wake up just unable to breathe. Okay? So at my worst, I would wake up every 30 to 45 minutes during the night when I was trying to lay flat in a bed and just wake up short of breath. It was because my breathing was so poor. And that is a very concerning sign. And this is a more subtle one, morning headaches and daytime sleepiness. People with sleep apnea tend to have these symptoms, and so do people with MG when their breathing is poor overnight. I would wake up in the morning with a hangover, even though I didn't have any alcohol to begin with. If I'm going to have a hangover, I'd really rather have the party beforehand. Okay? I want to have earned the hangover. Okay? I was waking up with just feeling very tired and headachy and everything, and it was because I was breathing so poorly overnight that my body was retaining a lot of carbon dioxide, and it took during the day to wear off. And when I woke up, all that CO2 in my brain was making it very apparent and making me feel hungover, tired, sleepy, and headachy. Okay? And that was a sign that this was very poor breathing. Okay? And the daytime sleepiness, because I wasn't getting good sleep during the night because my breathing was so impaired. Okay? So technology to the rescue. And I love this meme in particular. I won't be impressed with technology until I can download a beer. Okay? I haven't been able to download a beer yet, but I have been able to come up with all these little gadgets of mine that have greatly improved my quality of life. And my goal is to help people with MG understand that these are available and to try to get them for themselves. Okay? The BiPAP, okay, is one. A home ventilator. There's Mouthpiece ventilation, cough assist machines, and airway clearance vests. And we're going to be talking about all of these. So what's a BiPAP? Okay, many people have heard of CPAP that they use for sleep apnea, and that stands for continuous positive airway pressure. BiPAP means bi-level positive airway pressure. Bi-level, of course, means 2. So there's a nice high pressure for inhaling and a nice low pressure for exhaling. So my body gets lots of help bringing air into my lungs, and it doesn't have to work to exhale. Okay? It does work kind of like a ventilator that you see in the hospital. The nice thing is, unlike the hospital ventilators, There's no tube down the throat. It's just a mask over the nose or the mouth. I can use it during home, during the day. I can use it at night, whenever my breathing becomes shallow or I feel short of breath. Okay? And it's nice. Like I said, it cycles between the high pressure and the low pressure. Okay? And there's an example of a type of BiPAP mask. Okay? So BiPAP versus CPAP. Okay? You've got CPAP is only used for sleep apnea. Some pulmonologists are not familiar with the BiPAP and treating neuromuscular disease. So the very first pulmonologist I saw said, "Oh, I can get you a CPAP." And I was like, "No," and he insisted. I tried. It didn't end well. So when you have somebody with MG, unless their breathing problems are non-existent, they're going to want to go straight to a CPAP, straight to a BiPAP, excuse me. So it reduces the work of breathing. It helps me inhale. It allows me to exhale easily. Okay? Acute respiratory failure. So somebody who's going into crisis, especially if they go to the emergency room in time, most patients can find that a BiPAP is very helpful to help avoid being intubated with the tube down the throat. And given a choice between a mask and the tube, I will take the mask any day of the week plus leap year days. Okay? Seriously, but in order to be able to wear the BiPAP mask during crisis, they must be able to swallow, okay? And they must be cooperative. Okay? They must be alert. Somebody who's getting very agitated and they're trying to take the mask off all the time, the BiPAP is not going to be a good idea. Anybody who can't cough and swallow their saliva is not safe. Then they're going to need to be intubated and have the tube placed down. But if you can swallow and cooperate, the BiPAP is a great alternative. Okay? Chronic respiratory failure. So this is a home BiPAP. Okay? Nobody likes to be short of breath. Oxygen is our #1 basic human need. And I asked my students one time what their very favorite activity was, bar none. And they looked at me and they looked at me, and I said, it's not video gaming, it's not drinking, they're certainly not doing the homework I'd assigned, it's breathing. That is everyone's #1 favorite activity. And when you cannot do that, it is so uncomfortable. So having the BiPAP and the breathing support really significantly increases your comfort. Okay? It helps prevent pneumonia. It helps maintain that good oxygenation. It helps reduce those morning hangovers. And for me, it really, really helps keep me out of the hospital. I have not been in the hospital once this year, and it's because of my machines here. Okay? Sleep disordered breathing. This is when breathing gets worse during sleep. During sleep, especially during dreaming, all of the muscles in your body relax. Okay? Otherwise, as you're dreaming, you'd be throwing yourself out of bed, enacting whatever it is that you're dreaming about. So the body's muscles naturally relax during sleep, which is fine for most people. Not so good for anybody with MG, because we take those extra weak muscles and make the weakness even worse. And breathing gets very poor. So people with poor breathing due to MG, oftentimes their first symptoms will be due to poor breathing during sleep. Okay? This can be due to a couple reasons. One is the mouth and palate muscles can get weak, so they start to collapse and they block off that airway during sleep. That's like sleep apnea. But the bonus round is the respiratory muscles, the ones in the diaphragm and the chest. They get weakened and they start working more poorly, and so you wind up with sleep apnea, but worse. Okay? So sometimes that you might be having issues with sleep disordered breathing. If you're finding that you have orthopnea, you can't lay down and breathe at the same time, that's more of a party trick for me now. Okay? Morning and daytime headaches, if you're waking up with that hangover, difficulty waking up, morning grogginess, those are all signs that you're retaining that carbon dioxide overnight, and you might benefit from a BiPAP machine during the night. Okay? Home BiPAP, I do not look nearly as cute as this little girl. But the whole goal is to make less work for those respiratory muscles. We call that offloading the work of breathing. Okay? We're relieving shortness of breath. I love being able to sleep flat in my bed. Okay, that I really, really do love that. And the way I can do that is with my machine. Okay? I've got nice open air sacs in my lungs now. When my respiratory therapist brought my machine out, and she is like a good any respiratory therapist, she came out and she listened to my lungs and she hooked up my machine and she said, okay. Well, about 6 weeks later, she came back to check on me and how I was faring with my new little buddy, and she listened to my lungs and she stepped back and said, oh my goodness. She said, I could hardly hear your lungs before. All those air sacs had completely collapsed because you weren't taking good deep breaths due to your MG. Now, this machine does about 75% of the work of breathing for me overnight. She said, your lungs are now clear as a bell. And what's nice is now I can get up and walk better, I can talk better, and I'm feeling a lot better now that I'm actually getting good use of the entire area of my lungs. Okay? And I'm not waking up with those morning headaches anymore. So, many neurologists are not familiar with the criteria to get a BiPAP with NG. The first neurologist I went to, a pulmonologist, he said, well, you need a sleep study and you need to get a CPAP. And he was wrong on both counts. Okay? And when I went back to him later to educate him on some of the research that I'd done, he's like, wow, I had no idea. I'm like, yep. So, a BiPAP, there's a separate criteria pathway for people with neuromuscular diseases. Okay? And they will allow people with these diseases like MG to get BiPAP machines without doing sleep studies. Basically, you have to have a pulse ox less than 88%, okay, no biggie there. They can do blood gases, and if you're elevated CO2, that'll get you there. If you can't inhale and exhale, about 50% of what is expected, that'll get you there. But what really helps this population of MG people is the MIP. It's called the MIP or the NIF. Either one, they're interchangeable, it means the same thing. And it means the strength to inhale, okay? So it's the maximum inspiratory force, okay? Or the negative inspiratory pressure, okay? And either one of those, it should be at least about 90 to 100 for anybody that's healthy. Anybody without MG and good strength and good respiratory muscles should be able to score about a 90 to 100, maybe 110. Okay. For people with MG, if they are scoring less than 60 on this test, they qualify for a BiPAP just with that and an MG diagnosis. That's it, hands down. You can get one of these machines. Many neurologists aren't familiar with this, and neither are pulmonologists, because 90% of the people they see have sleep apnea. So patients have to be prepared with this documentation to say, hey, no, I don't need a sleep study, I don't need a CPAP, this is what I need, and this is how I qualify for it. Okay? So as I said, not the same as sleep apnea. Patients with MG, we have a rare disease. Most providers have never heard of it. They know about ALS, they know about MD and MS and all these different ones, but they do not know about neuromuscular respiratory failure and how MG works. So we have to be prepared to educate them. If you come in to an appointment with all this information, you can get the care that you need without having to have unnecessary sleep studies and unnecessary tests. Okay? Sleep studies, if anybody's ever had one, they have you wired up, you should be able to pick up signals from Jupiter, okay, because you are wired from head to toe. There's like 60 different things that they're monitoring, and they do it overnight. So one would think that will pick up any MG breathing difficulties I have. They probably do. Unfortunately, so much data is generated that they have to pick and choose and interpret how they look at it. And they look at it looking for sleep apnea. And unless they find sleep apnea, they're going to miss the whole MG breathing problem. So I had a sleep study, and it showed I had just a smidge of sleep apnea. Okay, my doctor's like, oh, we can treat that. It's kind of like having a trauma patient come into the ER, okay, wounds all over, and the doctor's like, we're going to fix his hangnail, okay? The sleep apnea was not my problem. It was a very minor problem. It's the fact that I couldn't breathe very well overnight. So sleep apnea, you can certainly do a sleep study, but if you're looking for MG, respiratory weakness management, sleep apnea study is not the way to go. Okay, sometimes people will have one though to make sure that their settings are correct. Okay, so if you like trying to sleep in the hospital, wired up to pick up sensors from Jupiter, feel free, but please know you do not need to have one in order to get one of these machines. Okay? Once you and your doctor have decided, okay, I think a BiPAP would be a really good idea, there's a bunch of different kinds out there. And of course, I had to make the progression from one type to another, and I wound up going through several different types of machines till I found the ones here that I use now. And there's a whole range of different acronyms. There's auto and ASV and AVAPS and whatnot. And what we found is AVAPS is uniquely suited to MG. So if you're going to get a BiPAP machine, you want to get the right one. Okay? Auto and ASV BiPAP machines are really nice if you have sleep apnea. Okay? And some people with sleep apnea don't do well with CPAP. They need a BiPAP, and they work great with those. Okay? But all these different ones, the VPAP Auto, the BiPAP Auto, APAP, ASV, I've tried most of those, didn't work. Okay? They're not recommended for patients with neuromuscular disease. So if you're going to get a BiPAP, go straight to the good one. Okay? The program called AVAPS is the very best, and it will say right on the machine if it has it. And it's designed to meet the needs of patients like us. Okay? My muscle weakness varies widely from during the day on a good day to when I'm sleeping and my muscles are very relaxed. And this machine will adjust the pressures as needed. Okay? And it's called average volume or assured pressure support. And no, nobody will ever quiz you on that. Okay? The nice thing about it is that the amount of pressure it gives me to help inhale adjust to where I need it, and the exhale pressure stays very low at what we call a 4. It's the very minimum. It's just enough to keep my air sacs from collapsing completely during exhale, but it gives me lots of breathing support with inhale. And for me, those numbers vary widely. My IPAP, that's the inhale pressure, when I'm feeling good, may average around 10. When I'm sleeping and my muscles are very relaxed, it will go up all the way to 40 sometimes. So it really varies, and only AVAPS has the ability to do that. Okay. So up here, I have a whole bunch of different machines that I'm using, and the Respironic System 1 AVAPS. That's the one that I have for travel. Voila, okay, very, very nice. This one is small, it's portable, it's very lightweight. And the ResMed AVAPS and the AirCurve S10A, that's another alternative. So these are two common little BiPAP machines that are small and will give you that AVAPS program. Okay. The nice thing about a little machine like this, I can rent to own it. Usually you pay for it for 11 months and it's yours. There's a built-in humidifier with it. It can have pressures up to 30. And for traveling, this thing is the greatest. Small, it goes in my little carrying case. Okay. The bad thing is if the power goes out at my house, there's no internal battery. Okay. It will beep to tell me it's shutting off. Hopefully that'll wake me up, and then I'm on my own. Okay. If I need higher pressures than 30, this is not the machine to use. Okay, there's no way for me to use a special mouthpiece, which we'll talk about in a minute. And you have to make sure if you're going to get a small unit like that, that it has AVAPS. Okay, the vast majority of them do not. So if you're looking for a unit like that, you want to have it say AVAPS or IVAPS on it. This one right here, the light blue one immediately to my right, is called the Trilogy. And it's actually the preferred unit. It's kind of the gold standard for neuromuscular disease. There's a couple of different ventilators like this out there. This seems to be the favorite. Okay. Nice thing is it's good for adults and kids, because unfortunately kids do get MG too. Okay. I can use a mask with this, or it can be hooked up to a tracheostomy tube. I have a friend who does that. And the nice thing is this will go up to a high pressure of 40, which sometimes I need during the night. One of the things that I really like about it is I can have two settings on it. So I can have one for during the day, one for at night, or I can have mouthpiece ventilation and use my mask. But I can have two different settings on it. Okay. It has 6 hours of battery internally. So the other day when our power went out for most of the day, and I was having a not so great day, I spent it in my bed watching Netflix with my machine. It was great. It beeped once to let me know that it switched over to battery, and I got to enjoy my ventilator for the entire day, even though we didn't have any power in the house. Okay. There's an SD card in it, which is lovely. I do not have to take this machine with me to the doctor's office. I pop out the little SD card, they pop it in their computer, and they see everything. Okay. There's no attached humidifier, so I do have a separate humidifier at home for it. It's expensive. A machine like this will run about $15,000, so it's more than my son's car. Okay. But this is an excellent machine, so I pay a very small amount every month. The respiratory therapist comes out to my house whenever I need anything. She brings me supplies. She came out last month with a bag full of supplies, and she looked like Santa had come at Christmas. She had tubings and filters and masks and all sorts of stuff. Okay. If anything happens to the machine, I call her, and probably the same day she's going to be out. Last month she came out, and she said, I'm going to swap out your machine because this one's due for maintenance. And so I don't have to do anything as far as maintenance. If anything happens to the machine, I call, and they bring a new one right out straight away. The only thing that I really do not like about it is 11 pounds. So when I fly, it is not very easy to travel with. Feels kind of like my ball and chain, but it's a wonderful ball and chain. So one of the things you want to think about if you're going to be getting a BiPAP machine is the masks. Okay, we have lots and lots of options. So you really do not want to wind up with like Bane here. Okay? You want to make sure that you get a good seal, make sure that you have a good fit, and most of all, it needs to be comfortable. A couple different options. One is a full face mask. Okay? If you have a lot of facial weakness, especially the nose and mouth, these work really, really well. You have to be able to remove them quickly, though. If you sneeze into your BiPAP mask, you're not going to have a good time. If you're going to be throwing up, again, that would be even worse. So the new ones now have magnets, so you can just pop them right off. Even if you have very weak hands, it's nice. You slide it right there, it'll fall right off. Okay. A hybrid mask. These are new. These have come out fairly recently, and it goes under the nose. And what's nice is I can wear my glasses when I have a mask like this on. And again, it avoids any sores on the bridge of my nose. The nasal mask, it's just going over the nose. Okay? And then a nasal pillow, those are my favorite. It just goes under my nose. It's kind of like a glorified nasal cannula that you see in the hospital. I can wear my glasses, and I can sleep on my side curled up in my pillow. A couple tips if you're going to be getting one of these. You can use a chin strap, okay? I can tell you the chin strap, the BiPAP, mask itself, and my little eye shades during the night, not exactly the picture of sexy, but sexy versus sleeping well at night and being able to breathe during the night, I'll take it, okay? You can adjust the straps. All of these masks have different types of straps, and they're all adjustable so that you can make them fit exactly what works best for you. And the AirFit F20, which is the mask on the very bottom, that one has magnets. Okay. And what's nice is you can slip your hand up, super easy to get off. Okay. Filters, very important. You don't want to get pneumonia. I was teaching clinical, and I went to go see my students in the hospital, and somebody had a machine, the CPAP machine from home, and they had never cleaned it. And there was mold and mildew through everything. So it's very important to maintain it and use filters to prevent getting pneumonia. These machines are here to help you, not to give you a big whole respiratory infection. Okay? One thing that I do is I get extra tubing and masks, and if I go to my local supply company, the tubing, they'll sell them to me for about $40 a piece. I said, that's a little crazy, so now I go on eBay, and I can get 8 of them for $40, and I have extras. And my respiratory therapist really likes me because when I get my Trilogy machine, I put a screen protector right on the front, and so it helps keep it from getting scratched up. So you can put a screen protector, just the same kind you put on your iPad or your cell phone. Mouthpiece ventilation. This is something that my friend Ashley really does this the best. Okay, and what's nice is that you can use the Trilogy ventilator without having to wear a mask. Okay? So there's the tube, and you put a small mouthpiece on the end of it, and it'll give you a nice deep breath whenever you want. Okay? So you can talk and visit and eat, but whenever you need to have a big deep breath, it will give you one. It doesn't give you your average size breath. It can give you a nice deep one, like a big deep sigh. It feels so good. And what's nice is it'll help improve coughing. It'll help prevent those little air sacs from collapsing. And for somebody that doesn't want to wear the mask during the day, it's very convenient. So when she's working from home, she can do a meeting on the phone, and when she needs to, she can take a hit on what I call her oversized hookah machine, and gives her nice deep breaths without having to worry about trying to take the mask on and off during that meeting. It's really nice. So my machine here is set for its primary setting. It's for me to use my mask during the night. If I want to use the mouthpiece, I flip it over to the secondary setting, and it's all programmed for me to use that. Okay. The nice thing is that the patient, all she has to do is put this up to her lips. She puts a little mouthpiece on the end of it, takes just the gentlest of little sips, and it gives her a huge, nice, deep breath. She and I have never smoked. This is the closest thing that we will ever do to a hookah, but it's absolutely wonderful. And the nice thing is that for people with respiratory weakness and lip involvement, there's a bunch of different mouthpieces that you can use. I like the ones on the bottom there. It looks like a big oversized straw, where she prefers the bent ones on the top. Okay. I like to put my lips around it. She has a lot of lip weakness. She doesn't have to worry about that. Puts it up to her lips, pushes it up there, and she gets this beautiful breath. Supplemental oxygen is not usually needed. Okay. That is a big thing with healthcare providers. Anybody who's short of breath, go to the ER. The first thing they want to do is give you some oxygen. That's fine, but most of the time with us, our pulse ox will be fine. We don't need supplemental oxygen. Okay? If you have an underlying asthma or COPD or emphysema or something like that, you might need some, but for the most part, we don't need any supplemental oxygen. All we need is breathing support. So all these machines can have oxygen hooked up to them, but for the most part, all we need is room air. We just need help getting it in and out of our lungs. Okay. If you give supplemental oxygen to somebody who doesn't need it, it'll actually throw off our breathing patterns and throw off the balance of oxygen and CO2 and acid base in the blood. It'll cause new problems. Okay. Cough assist. Okay. My friend is currently in the hospital with pneumonia, and she's got a lot of secretions that she needs to bring up, but her respiratory muscles are very weak, and she has a hard time doing that. So the machine on my far right, I call this Beast. I call that Son of Beast because it came later for me. That can help clear secretions from the airways. So you put the mask over the face, it gives a nice big deep breath of air in, and then it switches to suction, and it helps move secretions out. Okay? No tube down the nose or down the throat or anything like that, just using the mouthpiece or the mask. Okay? If you have the machine help get the secretions up to the mouth is very weak, then you can use a suction machine to remove secretions from the mouth if needed. Okay? And these are the two main ones out there, the Respironics Cough Assist, and I have the Hill-Rom Vital Cough. I found this one on eBay, brand, great condition. Normally retailing for about $7,000 to $10,000. Okay. Cough assist options, you can use a face mask or a mouthpiece. Okay. So whatever is more convenient for the person. If the person has a lot of mouth weakness, going to want to use the face mask. Personally, I prefer the mouthpiece. And I use this cough assist when I get a cold, especially when I get bronchitis, because I have a hard time coughing up the secretions. So I have this one on standby. I don't use it every day. People with a lot of secretions, they might have to. Okay. A couple signs that you might benefit from a cough assist. If you have a cough and you're trying to bring up secretions and your cough sounds really weak, that's a sign that a cough assist might be a benefit to you. If you have lung infections like pneumonia and you're always having those secretions down there having to be removed, this might be for you. Okay? Or if anybody needs frequent suctioning, especially suctioning of the lower airways. Okay? Medicare does provide coverage for cough assist machines and Trilogies. Okay, they just need to document. There is the MEP, it's the maximum expiratory pressure. Okay, and if you have a low MEP with the pulmonary function testing, that really gives a lot of criteria to Medicare to say, yes, this person does qualify, this person's going to need one of these. Okay, and they can also do another test called the peak cough flow. Okay? And that's part of the whole pulmonary function testing, and they can do the MEP, the peak cough flow with an MG diagnosis, and Medicare will say, yes, by all means, okay, let's get this machine for the patient. Okay? I just want to mention this briefly, the airway clearance vest. For some people, they have a lot of very thick secretions in their lungs when they have pneumonia, and they can stick to the inside of the airways, and it's very, very hard to get that off and get it up and removed from the airways and get it coughed up. So this vest is kind of different. Put on the vest, okay, not exactly a fashion statement, but put it on and it vibrates very, very quickly. And what it does is it helps knock those secretions off of those airways so it's easier to be coughed up. So if you have someone with a lot of thick secretions, put the airway vest on them and it'll vibrate everything loose. Then hook them up to a cough assist. It'll help take those loosened up secretions and get them up and out. Okay? So in case you happen to hear somebody mention an airway clearance test, that's what it's for. Okay? If you had a choice, or somebody's asking, oh, which one would be better? With MG, the cough assist would be the better choice because most of the time we're not having a big problem with the big, thick secretions. Our biggest problem is getting them up and moved out because of our respiratory muscle weakness. Okay?